Hello, Dr. James Bogash, expert in health and longevity, and as a practicing chiropractor who sees more than my fair share of low back pain patients pretty much every single day, this particular study just really reinforces what I've seen in over a quarter century of practice. And it was a study looking at 300 people who had lumbar disc herniation and so with radiculopathy, it's pretty uncommon to see sciatic pain without back pain, but they did differentiate these people between acute patients, so less than 12 weeks chronic back pain, and no low back pain. Again, a little odd to see somebody with a disc problem and no back pain, but it does happen. It's just pretty rare. So the world imaging can become a problem because we see something on an MRI, and I can't tell you how many patients I've had that come in and they're like, oh, it's my disc bulge, it's flaring up. I'm like, well, did you have an MRI or whatever? Oh yeah, like 20 years ago. And what you had an MRI 20 years ago is not what's causing your problems now. It may be contributory, but it's not that disc bulge that you had 20 years ago that people still think in their heads that that's what's creating their problem, and that is just not the case. So imaging a lot of times gives us the wrong idea, and it gets something implanted in somebody's head. Perfect example, we know that there have been studies showing that people who have MRIs have an increased risk of epidurals and then an increased risk of surgery. Well, the imaging did absolutely nothing to change the structural component. What it did was change the thought process of the patient around that. So they become more of feel like they're a little bit more out of control, and they now need things done to them to fix the problem. So that aside, what they looked at for the people that had back pain, the people who didn't, is looked at both the musculature around the lumbar disc region, around in the lumbar spine. So things like the paraspinal muscles and the multifidi. They looked at inflammation, specifically interleukin 6 and CRP in the blood, and they found that clearly with people who had back pain, there were a little bit of differences between the acute and chronic. There were alterations, there was more inflammation, and especially as things went to chronic, there was more muscle wasting, fatty infiltration. The muscles weren't as healthy. So what does this mean? For me as a chiropractor, my job is to get somebody out of the acute episode. And it is the patient's job to then keep that acute episode from becoming chronic, or if they're chronic, a lifestyle that's going to help promote better back health. This is not about getting adjusted 3 times a week for the rest of your life. That is not going to fix your diet, and it's not going to make you more active. Something that my profession needs to get out of their head and really understand that what the patient does is way more important than what we do. So staying active, that means if you can't move very well, things like yoga. I always say yoga is very bad for business, but I do promote it. Any type of activity, but we need to be moving. When you're not moving, those muscles start to waste away and you start getting fatty infiltration, and they're sick muscles and they can't do what they're supposed to do to prevent the back from hurting. And then general systemic inflammation. Not only is exercise anti-inflammatory, but our diet can be anti or pro-inflammatory. That means don't think for a minute that whatever you're shoving in your mouth is not going to have an effect on your back pain, because it absolutely will. And if you want to make sure that acute phase doesn't get to become chronic, or that your chronic condition needs to be better managed, we need to look at our diets being anti-inflammatory as well. So the bottom line is it's a comprehensive approach. I certainly think that chiropractic care is an integral part of that, but a good chunk of that is educating the patients and getting rid of what's called fear avoidance behavior. I can't tell you how many times I have conversations encouraging people to move when they've been told by other chiropractors, orthopedic surgeons, PTs to be careful how they do and not move and basically live their life as a China doll for fear of flaring up to low back pain. There's nothing that's going to create more back pain in the long run than not moving. So, as always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.